from Wish TV and Community Health Network. This is a Health Spotlight Town Hall Special.
Good evening. Thank you for joining us for this Health Special Spotlight. I'm Phil Sanchez. We're proud to partner once again with Community Health Network to talk about critical health issues right here in Central Indiana tonight. In honor of Minority Health Month, we want to focus our attention in multiple areas where minorities are underserved. That includes maternal and infant care, mental health care, and preventative care. First, News 8's Brittany Noble speaks with an OBGYN about Indiana's high infant and maternal mortality rates and what can be done about it.
Dr. Benson, can you tell me a little bit about the problem of infant and maternal mortality in Indiana?
Yes, it's unfortunate that our infant maternal morbidity and mortality is so high right now. So 2022 data that's out currently for infant mortality shows roughly 7.2 per 1,000 live births. So what that means, the way we kind of calculate the metrics, that's any death of an infant up until the first year of life, and then the denominator is always per 1,000. So that can correlate to roughly a little under 600 babies a year that are dying, and that's too many. I think any number is too many, right? But we're just trying to work really hard to try to decrease that number. When you look at maternal mortality, again, it's 2 to 3 times higher for women of color. And so we have work that needs to be done.
What is the disparity? Why is there so much work that needs to be done?
I think it's multifactorial, really, right? There's no one thing that we're going to be able to do to fix everything, but it really is a team approach that we need. So, you know, looking at things from a hospital standpoint, looking at things in the community, many things that we can do. So we're looking at, you know, access to care is needed, just getting information out for women so that they can understand the importance of early prenatal care, you know, knowing the different things to eat and, you know, the different things to watch out for, looking at their past medical history and surgical history, and all of these factors kind of coming together to make sure that they're getting the care that they need.
Are you finding that some women are afraid to come to the doctor?
I think many women are afraid to come to the doctor. I mean, you know, they have different experiences, whether that's from friends, family, things they've seen on social media. I know that, you know, nothing is perfect, so to say, but I think if we can just help women to understand the need for coming to see us and to know that we're going to listen. Our goal is really to help them. We don't have any other agenda other than to help women have safe and healthy pregnancies.
What are ways that women can mitigate the risks?
So I think knowing what questions you have coming in, right? I always tell my patients, bring your questions, bring your concerns. That's my job, to be able to answer your questions, to help you to feel more comfortable, to help you to know these are things you need to look for, these are things that are okay, these are things that you need to come in for if you're concerned about or you're having these symptoms. So that's one way to mitigate the risk. I think, you know, obviously self-advocating is always something. If you're concerned about something, say something. If you don't understand, continue to ask, because the answer is there to be had.
Talk to us about what community is doing to support women.
Community is doing a lot of great things right now. So one of the other things I wanted to mention was that I think for maternal mortality, there are a couple things that we look at, right? We look at causes of pregnancy-associated deaths, and then we look at pregnancy-related deaths. So the overall pregnancy-associated deaths right now in Indiana is overdose. And so community has worked with a program called the Choice Program, which is a program that's geared towards maternal, I guess the best way, substance use disorder. So helping women that have substance use disorder to get the help that they need so that they can have healthy pregnancies. When you look at pregnancy-related deaths, so that's things like cardiovascular disease, cardiomyopathy is a big one. A lot of women have a lot of these issues happening after pregnancy or in the postpartum period. So anything we can do to help women know the signs and symptoms of when to come back to the hospital to get care is a really big deal, and that can help to mitigate or decrease a lot of the risks and things that we see. Postpartum hemorrhage is another big one. So, you know, just really kind of staying connected is going to be the best way to help decrease those risks.
Dr. Benson, we want to thank you for coming in today. You've provided so much great information for us.
Thank you.
Good conversation there. Your mental and physical health are connected. What you can do right now to help your mental health just by making a small change in your routine.
The most local news. Wish TV. We are local.
And we welcome in Dr. Isaiah Sloss, now a psychiatry resident at Community Health Network. Doc, good to see you again. I know you were in about a year ago. It's always good to have you here. This is a big topic and something that makes headlines a lot. So here for Central Indiana, what are some of the mental health challenges that teens are facing today?
I think some of the biggest things that we have to look at, especially for our teens, are there a lot of challenges with school and interpersonal relationships in families and how to navigate some of those things. I think in general we've seen that people maybe have gotten a little bit out of practice with some of that, still kind of post-COVID and getting into the swing of things. But we really all have to try and find ways that we can maintain those good connections with our support systems and trying to be in a supportive environment. That way it can help us more having rougher times.
And the challenges in the Black and African American community, a little bit more unique, right? Speak about those a little bit.
Yeah, a lot of minority communities, including the African American community, are pretty poorly resourced, and that works out in a number of ways. It means it's usually harder to get access to a number of things. So, and with those poor resources, a lot of times you can see even more difficulty just meeting your everyday needs. Mm-hmm. And that can make it really difficult when you're trying to focus on, the basics, food, water, and shelter, to try and also manage some of those more higher level things like focusing on your mental health, focusing on, ways that you can be mentally healthy while you're trying to be as physically healthy as you can be as well.
And this conversation, I mean, it kind of there's a gray area as well, right? Because when we talk about mental health, everybody focuses on, okay, how do I get better mentally? But it also impacts your physical health as well. We were talking off camera where I feel like, when I don't exercise, I don't feel good. So dive into that a little bit, the impact that mental health has on physical health.
Yeah, I mean, it really is true that our brains and our bodies are super intrinsically connected. So when your body is exercising, it's active, you're kind of going through kind of the motions of like a healthy person, even if you don't feel that way, just, getting up regularly, getting dressed, brushing your teeth, taking care of your personal hygiene, scheduling regular exercise, eating food like regularly, ideally some healthy food. It'll get your body going, and it'll really help improve your mental health. Similarly, if you're exercising, you're releasing a lot of great chemicals for your brain. So those endorphins, they really kind of modify how you're feeling in a certain way, make you feel happy. And then you have that bonus of, I'm like being productive. I'm doing these great things. I'm like meeting some of these goals. And that helps to combat some of the things we see in mental health.
Community Health Network has a comprehensive behavioral health services partnership, I understand, for mental health services. Why is it important and how is it making a difference?
Well, one thing we know is it's important to be plugged into the community so you really can serve its specific needs. There's not really a cookie cutter approach that'll work every single place. So I think really trying to be involved in the community as much as possible, being involved in schools and more on the ground level, getting those one-on-one connections with people, it really helps us serve the community better, and it helps us deliver generally better health care.
I have about a minute left. Your final takeaway for the folks at home, what would you recommend doing maybe first if you're struggling with your mental health?
The first thing I always tell people to do is to reach out for help. If you have supportive individuals in your family or friend group who you feel if you were to open up about, they might be able to give you some support there. You're always, I advise people talk to, school counselors, talk to maybe a trusted teacher or other adult figure. If you can see your physician, if you have a regular family physician, you can start to maybe get the ball rolling on getting an assessment so you can get referred to see, somebody like me who's a psychiatrist or maybe getting involved with therapy. There are all many different steps, but I think reaching out is sort of that first one because a lot of people suffer in silence, and as much as possible we want to try and prevent that.
So important, such a good conversation. Dr. Sloss, always good to see you. Thanks for being here.
Good to see you too.
Yeah. taking care of your body before something happens, why getting your annual physical and screenings can set you up for success.
Wish TV. We are local.
Welcome back. Well, there are multiple pre-existing conditions that can have a major impact on your health, some of which you may not even know you have. News 8's Hannah Murdo speaks with a family physician about what steps you should be taking every year.
Let's welcome in Dr. Danielle Lovelace, a family practice physician with Community Health Network. Thank you for being here. Important topic, preventative care specifically for minority communities. Talk about some of the chronic conditions that people are facing.
I think, one of the most important that we have to focus on is coronary artery disease or heart disease, because it's the #1 cause of death in the United States, regardless of race, regardless of sex as well. And so when we look at risk factors for heart disease, hypertension, diabetes, hyperlipidemia or high cholesterol, obesity, sedentary lifestyle, smoking, the other thing is family history of early heart disease.
As we focus on that, why are there higher rates of these conditions for certain communities?
So access to health care can be a big thing that is prohibitive of getting good care. You don't have the funds. We look at transportation. We look at food deserts and healthy food. When we talk about treatment and cause, we always say, well, one of the first line of treatments for hypertension, diabetes, high cholesterol is diet and exercise. Mm-hmm. So of course we want to encourage those things, but we also have to be realistic. Sometimes people can't afford to eat healthy. It is easier sometimes or more economical or affordable to eat unhealthy in terms of grabbing something quick, canned foods that have a lot of sodium. And so we also have to make sure that we are aware of that. And then also sometimes within the African American community and other minority groups, there is a distrust of healthcare and healthcare providers because of the history in which we have. And so it's our job as healthcare providers to educate and make people aware and make our patients feel comfortable. And we also want to make sure that we ask the questions, because some people are not going to readily volunteer that they don't have access to food, that they can't afford their medications. So we do questionnaires when they come in, and then we have resources that can help. We have social workers, we have pharmacists that can help people get the medicine that they need. We have resources where we can get people in who don't have transportation to their visits. We can get a Uber to them and Uber them to their visits and Uber them home. And so those are the kind of things that we as a network and as providers just in general can actually make impact in improving the health care of the patients in which we serve.
You're taking all of these steps and actions to help people have better access, be more trusting, but they do need to get screenings. What are these screenings and how often do they need to get them?
So the thing is that I always say, particularly with hypertension, it's a silent killer. Most people who have high blood pressure don't even know it. They have no symptoms, and they can be walking around with levels of blood pressure that could be at stroke level or that can be induce a heart attack. So screenings for that are very important. At least you want to get, I tell people, if you have insurance, right? Because again, there sometimes are access. You should get your physical every year, right? People, we talk about the economics of medicine. It is expensive. But if you have health insurance, it doesn't even go towards your deductible for your preventative care. So once a year, get into your provider and get your physical. Get your blood pressure checked with your heart rate, because, you can have a normal blood pressure, but your heart rate can be abnormal. You can have a atrial fibrillation or something like that can cause a stroke or a heart attack. You want to get your cholesterol, because when we talk about risk factors for heart disease, high cholesterol is one of them. So you want to get that done on an annual basis. You want to get screened for diabetes. That's so important, particularly in the minority population. When we talk about diabetes, African Americans, particularly in the United States, the number 2 ethnic race or group that has the highest level of diabetes in the United States. Number 1 is Native Americans, but number 2 is African Americans, and number 3 are Hispanics. And so diabetes plus hypertension increases your risk for heart disease 2 to 4 times.
Yeah, and you as the patient, take control, get these screenings, and do this preventative care. Dr. Lovelace, thank you so much.
You are welcome.
All right, coming up, reaching everyone, how Community Health Network is making sure they can provide service to anyone who needs it.
You're watching Wish TV. We are local.
And welcome back. I'm joined now by Ken Bond, the Chief Diversity and Inclusion Officer with Community Health Network. Ken, good to see you. Thank you so much for joining us.
Yeah,
absolutely. Good conversation here. Community Health Network, as you very well know, Ken, is committed to DEI. So talk about, for our viewers at home, what that means and how it's helped out community and the commitment to it.
Absolutely. So DEI, let me start there. Diversity, Equity, Inclusion is what that stands for. And primarily, a couple years ago, we had a heavy lift of establishing our DEI initiatives and department. So the network went through this establishment of the department. And then furthermore, today, fast forward to today, we have a tweaking of that strategy. So we're leaning into DEI, whereas others are pulling away and back. We are leaning in, and we're committed to it. It's made us a better network, and that's where we are. We're committed, locked in.
So you took on this role, this new role at the end of last year. So what is the goal moving forward? I know you say you're leaning in, but aside from that.
Yes, sir. So as far as that heavy lift that happened a couple years ago, we had an initiative or a strategy that was established that included 6 pillars, all the way from belonging and inclusion up to supplier diversity. In between, there are 4 other pillars. And so as a part of that process, we've locked into goals and work that needs to happen underneath that. And so within that work, we have also established groups, resource groups that help us, like provider resource groups, Black provider resource group, nurses resource groups, women's services leadership resource groups. So that work that has happened that I get to continue 2 years later is further locking into that process and tying that into our overarching mission, vision, values of our network.
For people who maybe aren't familiar, why do you feel that that's going to help you guys be a little bit more successful?
It's important simply because being different matters. And we're not all the same. We're sitting here on set, and we're 2 different people, 2 different human beings. And as a part of those differences, I celebrate you, you celebrate me. It makes us all better. Our network has realized that. And I work for the best healthcare system, I believe, in the city, because we are locked in, again, to that work of being different, and we celebrate those differences.
Listen, you're talking to a guy from Queens, New York, the melting pot of the world, really, so I totally agree. Transparency is a huge thing too, and people can go over to your website and find this out. Why is that important? Why is that a good
Simply because the gates by which we are successful are measured by diversity, equity, inclusion, and risk and quality and safety. So that's the transparency we're talking about. And so when you're talking about being transparent, you're willing to open yourselves up for the view of others, and also looking at ourselves. We're harder on ourselves than anybody could ever be, because we want to be perfect, we want to be successful, we want to be the Community Health Network, and we want to be the network that people choose to get their health care from.
So that's in-house. From a patient's perspective, how is this going to help patients coming in?
Simply because we have, again, if I look across the spectrum of our network, we have over 45 languages that we serve within our network. Different languages outside of English. And so when our patients walk into our healthcare system, we have to be able to take care of them in their native language. We're able to do that because we have a virtual remote interpreting solution. We're just able to hit a button on an iPad. And we're able to pull up 45 different languages. Just last year, our patients generated over 2 million minutes of interpreting. And so that's welcoming, that's belonging, that's inclusion.
Unbelievable. I have about a minute left, Ken. Is there anything that maybe I didn't ask that you want the viewers to know?
Simply put, we're a network that celebrates culture and celebrates differences. I wouldn't be sitting here. I'm a 22-year Air Force veteran. commissioned officer.
Wow.
I wouldn't have been able to be a commissioned officer in the Air Force without DEI.
Right.
And so as a result of that, I worked at the highest levels of government, from Capitol Hill all the way to the Pentagon.
Yeah.
And that has taught me that DEI matters. And I want people to understand that we're leaning in as a network, and we're leaning in because it makes us better. And that's why I'm here.
Well, first off, Ken, thank you for your service.
Yes, sir.
Thanks so much for being here today. Good conversation,
Yeah.
good stuff what you guys are doing over there at Community Health Network. Fantastic job. Hey, for you at home, thank you so much for watching us tonight here on the show. We'll see you back here tonight coming up at 10 and 11 and always online at wishtv.com.